The Cochlear Vistafix system is a unique clinical solution for patients who are seeking a facial prosthetic solution. It's based on technology that was first introduced with the Cochlear Baha system and is very similar in terms of the implant foundation there. It's often used for patients who have congenital malformations of the external ear, such as microtia or atresia patients, tumor surgery, or trauma, which includes burns. The Vistafix system itself is built around a series of small titanium implants which bond to the bone through a process called osseointegration. It's an attractive alternative to patients who have maybe tried other reconstructive surgeries or other prosthetic retention systems such as an adhesive retained prosthetic. The Vistafix procedure is often fairly straightforward, but it's important that it's performed in collaboration with the entire treatment team. This treatment team would consist of surgeons, audiologists, anaplastologists, who are the technicians who create the prosthetic, and technicians. The Vistafix system consists of three primary components, which include the osseointegrated implants, the abutments which connect to the implant, and then a retention mechanism for the prosthetic. Attached to these three components is the prosthetic that the anaplastologist makes. There's two types of retention mechanisms that are commonly used today, either a bar and clip, which is the more traditional mechanism, or a magnet retained prosthetic. Either option are commonly used, and they're both easy to attach with minimal effort on the part of the patient. The procedure primarily consists of 4 steps. The first step is where the surgeon implants the Vistafix implant. Next, there's an osseointegration period, typically of 3 to 6 months. At that point, after the osseointegration is complete, the abutment can be attached to the implant. After this step is completed, the anaplastologist makes an impression of the site, which they use to craft the final prosthetic, and then at the day of fitting, final adjustments are made to ensure symmetry on both sides of the face. Other changes in the Vistafix 3 system include changes to the abutment, which has been redesigned to provide improvements in terms of soft tissue stability. And finally, with the Vistafix 3 system, there's some new innovations in terms of the magnetic retention systems, which give patients improved confidence, particularly with auricular systems, that the abutment and magnet system are going to stay in place. The biggest benefits associated with the Vistafix system are that it brings forward improved quality of life for patients and improved confidence in how they go about their daily activities, whether that's with friends and family or enjoying their community more than they were able to prior to the procedure. A lot of patients will talk about feeling like their implant isn't even there. It becomes a part of their life that becomes very natural. Even if a patient is exercising or engaging in physical activity, they can remain confident that the Vistafix prosthetic is going to remain in place. So the biggest benefit for audiologists being involved in the whole process of the Vistafix procedure, whether that's initial counseling or all the way through the final fitting, is really particularly for patients with the congenital malformations. The microtia atresia patients often have that conductive hearing loss element, and that's why we often see a Vistafix procedure being performed in conjunction with a Baha procedure. It's something that we want to make sure that the audiology community is aware of this as another alternative, particularly as patients get to a certain age where they may become more self-conscious. A lot of our patients who go through the counseling process for Vistafix procedures are at an age where they're about to go into a public school, into a middle school, times when they really become more socially self-conscious, and that's when parents together with the child often make the decision that this is the best alternative for them, so that they can go through their life without feeling like they're not able to participate fully in community activities and sort of normal school age kind of activities. Recent advancements in prosthetic technology, including changes in the silicone materials that are used in the prosthetic, coupled really with the advanced skills of the anaplastologists themselves, are able to deliver prosthetic outcomes that are so lifelike that it's difficult to tell, unless you really know what you're looking at, that there's a prosthetic involved at all. The outcomes are almost undetectable as far as being different from the natural ear. Thousands of patients worldwide have received a Vistafix procedure, and the Vistafix 3 system is the latest innovation in bone-anchored facial prosthetic retention systems.